Hi, and welcome to my channel. My name is Lolix. In today's lesson, we'll be taking a look at Part B of the reading section of an OET sample exam. We will read the instructions first, then look at each question and the associated extract provided to find the answer. You can and should pause the video at each section to read the question or extract on your own. Let's get started. In this part of the test, there are 6 short extracts relating to the work of health professionals. For questions 1 to 6, choose the answer A, B, or C, which you think fits best according to the text. Question 1. The manual informs us that the blood pressure monitor, A, is likely to interfere with the operation of other medical equipment. B, may not work correctly in close proximity to some other devices. Or C, should be considered safe to use in all hospital environments. After reading the provided extract, the first thing that jumps out to us is this part of the text. Medical equipment may be susceptible to electromagnetic interference. This may result in incorrect operation of the medical device. Now, this agrees with option B, which states that it may not work correctly in close proximity to some other devices. But going forward in the text, now we see medical device conforms to a standard for both immunity and emissions. Now, this is stating the opposite of option A, which is that it is likely to interfere with the operation of other medical equipment. So medical devices are held to a standard so that they don't interfere with each other. Next, we see that care should be taken to avoid the use of the monitor within 7 meters of cell phones or other devices. Once again, this opposes option C, which states that it should be considered safe to use in all hospital environments. So we have 2 sentences in the text that oppose 2 of the options given. So the correct answer to this question is option B. May not work correctly in close proximity to some other devices. The next question. The notice is giving information about A, ways of checking that an NG tube has been placed correctly. B, how the use of NG feeding tubes is authorized. Or C, which staff should perform NG tube placement. So from the question, we have 2 options, A and C, which talk about NG tube placement. But option C is also about the staff that should perform the placement. So the more important thing to note in option C is which staff should perform the NG tube placement. Let's look at the text. After reading the text, the very first word and the very beginning of the second sentence talk about the positioning of the NG tube, which agrees with option A. But none of these sentences talk about the positioning or about checking the positioning of the NG tubes. So they are not the correct answer. Next, we see that the insertion and care of an NG tube should therefore only be carried out by a registered doctor or nurse. Now this is directly agreeing with option C, which staff should perform the NG tube placement. And option B, how to use the NG feeding tube, or the authorization of the use of NG feeding tubes, is not talked about at all in the given text. So the answer to question number 2 is C, which staff should perform NG tube placement. Question number 3. What must all staff involved in the transfusion process do? A, check that their existing training is still valid. B, attend a course to learn about new procedures. Or C, read a document that explains changes in policy. So here we see that the text states all staff involved in the transfusion process must be competency assessed. So what that means is the staff capable of performing transfusions? Or in other words, are they trained to do it? The next thing that we can note is that if they take any part in the transfusion process, their competency assessment is updated every 3 years. So from that, we can associate that with option B, which is to attend a course to learn about new procedures. But the given text does not say anything about new procedures. It does talk about a course, which will happen every 3 years, but nothing about new procedures. Next, we have a sentence about relevant training courses are identified in Appendix 1 of the mandatory training matrix. This correlates to option C, which states read a document that explains changes in policy. But this talks about a document, but not about any changes in policy. It's rather about training courses. So option C is not the answer here. And also option B is not the answer. So the answer is option A. Check that their existing training is still valid. Question 4. The guidelines establish that the healthcare professional should A, aim to make patients fully aware of their right to a chaperone. B, evaluate the need for a chaperone on a case-by-case basis. Or C, respect the wishes of the patient above all else. So here in the text, we see if a chaperone is offered and declined. So this means that we are making the patient aware that they can have a chaperone and they can either choose to accept or decline it, which correlates to option A, aim to make patients fully aware of their right to a chaperone. But over here, the text does not state anything about the patient's rights. It's just that there is an option to either have a chaperone or not. Next, we see it is often a question of using professional judgment to assess an individual situation. Now, this is very interesting because it paraphrases option B, which is to evaluate the need for a chaperone on a case-by-case basis. So Using professional judgment to assess an individual situation is paraphrasing the option B. Then for option C, the closest text that we can see in the extract is unless the patient specifically requests the chaperone to remain, which one might read as respecting the wishes of the patient above all else. But this is a little bit confusing, or it is rather designed to confuse the reader, because the option given, respect the wishes of the patient above all else, means that nothing else matters when it comes to the case of a patient wanting a chaperone. Everything else is secondary or below the wishes of the patient. Now, such a strong extreme statement is not given in the extract. So while this is confusing, the answer to question 4 is B. Evaluate the need for a chaperone on a case-by-case basis. Question 5. The guidelines require those undertaking a clinical medication review to A. Involve the patient in their decisions, B. Consider the cost of any change in treatments, or C. Recommend other services as an alternative to medication. Here in the text, the first thing to note is all patients should have the chance to raise questions and highlight problems about their medicines. Any changes resulting from the review are agreed with the patient. So this is directly agreeing with option A, which is to involve the patient in their decisions. Next, we have avoid the need for costly treatments, which we can consider to be agreeing with option B, which is to consider the cost of any change because of the word cost. However, option B is to consider the cost, while the text provided is to avoid the cost. And option C, recommend other services as an alternative, is not talked about in the given extract. So option C can immediately be discarded. So, and since option B is also not exactly explicitly given, the answer to question number 5 is option A. Involve the patient in their decisions. Question number 6. The purpose of this email is to A. Report on a rise in post-surgical complications. B. Explain the background to a change in patient care. Or C. Remind staff about procedures for administering drugs. So in the text, for option A, we have the statement, reported the incidence of respiratory depression among post-surgical patients to an average of 0.5%. Thus, for every 5,000 surgical patients, 25 will experience respiratory depression. Now, this we can talk. This talks about post-surgical complications, but it does not indicate a rise, or it does not say an increase in post-surgical complications. Simply gives a few numbers. Next, we see that it is therefore recommended that post-operative patients now have continuous monitoring instead of spot checks. So this is a change in how procedures are done. because of the phrase now have and instead of. So now have talks about now and instead of talks about what it used to be like. So there's a change in the procedure. But for option C, which is to remind staff about procedures for administrating drugs, is not talked about in the given extract. So the answer to question number 6 is option B. Explain the background to a change in patient care. With that, we've come to the end of today's lesson. If you have any questions or doubts, please leave a comment. Thank you.